So often with knee pain, there are a lot of like myths and rumors and lies that are told to you about what you need to do for your knee pain. There's so many things, rest it, protect it, ice packs, CBD oils, all these things, knee braces and all these things that you can do, massages and all these treatments and stuff. Honestly, none of that really does anything to change and really only addresses the symptoms, not the root causes of the problem. That's one of the biggest things is we spend way too much time treating the symptoms instead of treating the root causes. So resting it definitely isn't going to treat the root cause. And the cause isn't movement. It's not that you're overusing it. It's that we're putting more load on it than it can handle. And so we really need to just build up how much you can handle. And that's the key. And so you'll go and get imaging and other things like that. Well-meaning, physicians or surgeons or, healthcare providers are going to tell you that, on your x-rays or MRIs, we saw this, this, and this. You've got a torn meniscus or a torn this or that, or you've got some arthritis developing, you're bone on bone. All those things sound awful, but honestly, they're just wrinkles on the inside. Just like our outer body changes as we age and as we, move and do things. We get scars and stuff like that. We get those on the inside too, and it doesn't mean that we're fundamentally broken. It doesn't mean that we have bad knees. They're not bad. They've got some wear and tear on them, and the way that we battle that wear and tear is to build them up, to get them stronger and to keep moving, not rest them. They're only going to get weaker the more we rest and have more pain and more problems. So what we need to do is build them up in the right way. One of the biggest myths is that running is bad for your knees and that jumping is bad for your knees. And actually, both running and jumping have been shown to be protective for cartilage, for bones, tendons, ligaments, and muscles. They've been shown to be helpful at building up your capacity. And runners actually have less arthritis than non-runners, fewer surgeries than non-runners. And it's been shown to even reduce the formation of arthritis, or can even reverse, depending on a few factors, but can even reverse the progression of arthritis in people. So running is not the problem. Maybe running with poor form or running with weakness that makes our mechanics off, but that really is just building yourself up, and it can fix all of those things. So running isn't the enemy. Movement is not the enemy. Stairs are not the enemy. What the enemy is not having enough strength and capacity to handle those loads. And that's exactly what we're going to show you through this program, is how to bust those myths, get back to moving, build up your strength enough that you can do all the things that you love to do again.